Welcome, to Loretto. We're going to have an official welcome in a second. It's great to see everybody here on a blustery day. Make sure you all sign in today. Grab some food anytime you want. My name's Lee Rush. I'm the director of the Westside Heroin Opioid Task Force. I work at Prevention Partnership. In fact, I'm one of the co-founders with Lou Sias is over there making sure people are signing in. And Al Orsello, where's Al? Al Orsello, 33 years ago, we founded the organization with the assistance of Danny Davis, and here we are working with the people who really want to make a difference in the community. So I'll go through the agenda a little bit. I want to introduce you to Dr. Giovanni, who is from Loretto Hospital. She'll welcome you to Loretto and give you a little overview of what they have going on in relationship to the opioid crisis. So thank you.
Sure, thank you. Hi. Sorry. My name is Dr. Nikhila Javadi, Chief Clinical Officer at the Loretto Hospital. We'd like to welcome you all. Thank you for coming. We're very pleased to host the Westside Heroin Task Force meeting today. On behalf of our President and CEO, George Miller Jr., our Board of Directors, and our senior leadership team, we want to welcome you all to the Loretto Hospital. In 2015, State Representative LaShawn Ford brought to our attention the heroin crisis on the west side of Chicago and urged us to pull together to combat this issue. This is not a new problem, but it is one that requires the right people at the table who are willing to roll up their sleeves to do the work. That is why we are all here today. For more than 40 years, the Loretto Hospital has been addressing the needs of those struggling with substance use disorder. But it is time to do more. We are ready to join forces in improving the programs and health outcomes in the community that we already offer. Many of you have heard, but last year, our emergency room received a number of patients in less than an hour, more than 10, that had overdosed on heroin. We saved their lives, all of them. But in part, that was due to Narcan, the initiative that we would like to acknowledge Representative Ford for and all of you for in bringing into law. And we'd also like to take this time to tell you a little bit about what the Loretto Hospital is doing to help prevent this crisis. Due to this and other instances that happened, we decided to take more initiative with our substance use programs. We have started a new Suboxone and Vivitrol program, both for opiates and alcohol use disorder, within our clinic system. We have recovery coaches, we have counselors, all of that, and we'd like to take this opportunity to let you all know about it. And at the same time, this is why our partnership is so vital. We are stronger than we are separate, together than we are separate. No one person or single organization can fight this crisis alone. And so the Loretto Hospital is pleased to join forces with the Heroin Task Force to heal our community and to improve overall health outcomes. Thank you. And at this time, I'd like to take any questions. Yes, please.
Will you be administering any training?
Absolutely. So we've had Vivitrol training, and we've also had training regarding, actually this past week with our CADC workers, which is our counselors for substance use, regarding the new ASAM criteria and other various, certificates and initiatives that have been going on. Yes, absolutely. Anything else?
Do you have an inpatient detox right now?
So currently we treat our substance use patients as medical patients if they have any medical issues, but we have detox, we have our 28-day residential rehab program, and we have actually won a grant for a shorter 3 to 5 day short-term rehabilitation program. We also have intensive outpatient services and DUI services that we offer. We do have support groups. I'm not sure about the exact 12-step support groups, but we definitely have group therapy, family therapy, counselors on site that do take appointments and that we do do therapy for, yes. We also have our outpatient mental health. It's located at a little boy over there at Symphony West, but they have family therapy, group therapy, and we cross-connect people with these use disorders because there's always a dual diagnosis sometimes that goes on with substance use and mental health, so we want to make sure that we're addressing both those issues. Okay, great. Thank you so much.
So, real honored to have the Secretary of Illinois Department of Human Services, Grace B. Howell, with us. Excuse me. Great to have you here. And LaShawn Ford has joined us. So, we wanted to, first of all, recognize some folks who have really done a great job. And I know that two of them aren't here, so, but I want to make sure that before we're done here that we recognize them as well. But we really, I think that when we started in July, kind of restarted in July, I think one of the stakes that was put in the ground that allowed us to have some real visible action around the task force and move beyond kind of talking about the issues and problems was when Ed Boone from Lurie Children's Hospital in Sudor came up to me and said, hey, we got to do a block by block. Would you help me do this, or will you work with us to do this? And we did. And at our first meeting that we had in August, there was a couple of people that raised their hand and said, we'll volunteer to lead some of the work groups. So we had two work groups, a training work group, and we had an outreach and recruitment work group. Our outreach and recruitment work group was led by Courtney Olive, who's from Build. She's unable to be with us today and moving forward, but we were really happy how she started it. And the other person was Dora Danzler-Wright, who was from CRCC, and so we wanted to recognize them for sure today. So if you would come up, both of you, and we want to introduce Grace. Thank you so much. So these are folks, when you're kind of starting out as an executive director, when you're a director, you promoted me, I'm just a director, I'm not an executive director. Anyway, you know, you get pushed by people whose passion and commitment, you know, really like, hey, this is a real deal. You got to get up every morning and strap it on, you know. So, and these guys did that. So I want to let you guys get them the
Secretary, this year.
Over there for the cameras there. There we go.
Congratulations.
Thank you. This is a work in progress, and Ed's gonna get you fired up in a few minutes when we have some announcements. But thank you very much.
Because of the secretary, we also have a little funds to work this task force. And of course, we want to butter up because we definitely need more. But nevertheless, the secretary knew that we needed funds on the west side, and not only did she help us get the funds for the heroin task force, but she also made sure, I can't say she made sure, but we even got funds to do the census on the west side. So the secretary, thank you so much for that. I think that we got almost $2.5 million to do census work on the west side, and then we got a few dollars to do the West Side Heroin Task Force. And so thank you, Secretary. And you can cash it.
Put it in your wallet.
We're going to go to ABC Bank. Are they still around? I don't know. So, thank you so much.
Secretary.
Did you want to speak? And okay, I think we don't have any microphones. So.
No, it's fine.
Okay, thank you so much.
Thank you so much for having me here. Good afternoon, everyone. I think you probably have one of the hardest working members of the General Assembly in your midst. I've actually had the opportunity to talk with Representative Ford on a variety of issues that cover the Illinois Department of Human Services since I just started in this capacity 6 months ago. You know, we've talked about the work that we've been trying to do to decrease the Medicaid backlog, which I know has significant issues on the things that we're talking about today, our ability to timely process SNAP or food stamps, We've also talked about kind of our need to drive the enrollment for the child care program up, increase eligibility, work to increase rates, and then, of course, what we're talking about here today, which is substance use disorders. So Representative Ford, I think, keeps us accountable at the executive branch. I really see him as a partner and really pushing and encouraging us to do better, which we certainly need to do. But I have to tell you that coming back into the state after having been gone for 7 years, the past several years have really been hard on the Illinois Department of Human Services. And I think as a result, it is hard on the communities that we are really most supposed to be serving, right? And so I recognize that there's a sense of urgency for us to kind of correct all of the issues that we are challenged with in a short amount of time. And we are working urgently to try to do that. But the only way that we can do that is in partnership with all of you. So even as we're trying to build a foundation and make it stronger for us to build on, we're also trying to create new opportunities at the same time. The census work obviously is critically important, not only for today and making sure that there are boots on the ground in the hard-to-count communities, but we know that it has ramifications on funding for our neighborhoods and our state in years to come, for the next 10 years. And we also know that those who are most able to encourage people to apply for the census are community members, people who have respect and the trust of the community folks who may have felt or may feel a little bit disenfranchised by government. But we need to bring folks into the fold. So I would say that this is my second visit to the West Side over the past several months. We've also had the opportunity to expand youth program funding over the past summer as well. And so we're trying to work on a variety of levels to try to increase resources here. But I know today we're here to talk specifically about kind of substance use disorder. How do we make sure that this community, that your community, is resourced in the way that you need to be? But I feel like one of the key cornerstones, right, to government should be about partnership and being in partner with you all as community members. We think of your task force as a pioneering effort, right, a model that should be replicated in different parts of the state. I think one of the things that I recognize as the Department of Human Services is that it's been so clear to me since coming on board again is that the more issues that you confront as a person, right, if you have a diagnosis or if you have experienced homelessness, right, if you have other issues, domestic violence, or live in neighborhoods that have been impacted by a variety of disinvestment, there are more and more doors that you have to knock on in order to get the services that you need and you want to be employed, to be healthy. And so one of the challenges that I want to take on at the Department of Human Services is to figure out how we can work more collaboratively with community to create one-stop places for human services. We experimented with that in the past when I was previously Assistant Secretary for Programs, when we brought in private philanthropy, and we called them open door offices, and we worked very closely with the faith community as well. And we worked with all the different parts of our agency to make sure that when people needed help, they didn't have to go here for mental health. They had to go here for SNAP, and they had to go here for different youth services or after-school programming. That is my ambition, and I hope to work very closely with many of you. I think one of the things that we recognize is that the community here has borne a heavy burden when it comes to the overdose crisis. The number of state opioid overdose deaths decreased slightly in 2018 for the first time in 5 years. Meanwhile, the rate has increased for African Americans. Disparities like these are why the task force is so crucial, and then why we need to listen to you as we make determinations as to how we execute policy and implement resources. Bringing overdose education and other resources to the West Side is exactly what needs to be done. I think many of you have been part of the opioid task force that the department has been leading with our sister agencies, Illinois Department of Public Health. And right now we're talking with the governor's office and lieutenant governor's office as to what the next chapter of our opioid executive order as well as the task force needs to look like. But I think one of the things is definitely true is that the facts don't lie, right? And that we have not paid enough attention to the inequities in the way that this crisis has impacted communities, right? And so we want to have a very strong equity lens for the next chapter of our work as it relates to dealing with the opioid crisis. And I think, you know, what a difference new leadership makes, right? I think in the General Assembly, with partnership from the governor, you know that the cannabis recreational legislation was passed with an equity lens, right? And so we are actually going to be seeing more resources through the leadership of the Lieutenant Governor's office, as well as through the Department of Human Services, where we are getting more resources to actually implement and deploy into communities, but we're doing it through an equity lens. And so when I was, the 7 years that I was absent from when I was Assistant Secretary to when I started in March as Secretary is I was President of Woods Fund Chicago. Woods Fund Chicago is a private grant-making foundation, and we funded organizations to do community organizing and public policy advocacy to fight the brutality of structural racism and poverty. And so it was actually kind of a great opportunity just to be embedded in research and policy change as it relates to how our laws, rules, and our actions as government actually create inequities rather than resolve them, to really begin to figure out what the root causes in historical oppression and marginalization of certain populations was. History is what we are working against, but we need to inform how we move forward. And so we need to, I think, look at the lens through this equity framework, and not just race, but also geography. And so we are committed to addressing health disparities, human services disparities within the current Illinois opioid crisis. This falls in line with the overall focus of equity and inclusion that we have at our agency. We just launched an Office of Strategy, Equity, and Transformation, and we're going to look at data and see how it informs or doesn't inform where our services are delivered. And we're going to do the same thing for the dollars that we're getting through the recreational cannabis legislation. I know that increasing access to naloxone and increasing awareness through the helpline are important steps as well, but they will not entirely resolve the racial equity disparity related to opioid overdose. We recognize that a number of factors play a role in increasing a person's risk for overdose. They are not only a person who is struggling with substance use, right? We know that there are a variety of other factors that they face that have led them down this journey and this path in life. And it is incumbent upon the Department of Human Services to provide the array of services and supports so that they can not only survive an overdose, but actually thrive as a community member. Over 16,000 people with opioid use disorders have been served through the outreach, treatment, and recovery services supported by the Opioid Crisis Response Grants awarded by the Department of Human Services. And you know these grants fund a variety of programs within reach into the West Side community, all for people with opioid use disorder. We are building an array of partnerships. I mean, I was glad to hear a lot of the hopes and dreams and aspirations of this group, and we want to figure out how we can be a part of it. The grants that we make also strive to improve access to recovery-oriented housing. I think it's hard to recover and overcome substance use disorder if you don't have a place to live. And that this model of Oxford houses, which are peer-led community-based sober living options for people in recovery, are a critical component of that. But I know that it's not enough, right? We recognize that it's not enough, and I think it's important for us to say that we need to do better. I know we need to do better. We want to do better. We will continue to listen to affected communities to ensure that you are included in planning and implementation of our policies and practices. We have a monthly Illinois Opioid Crisis Response Advisory Council, which I invite you all to participate in. And we appreciate the dedication and hard work of community-based organizations, because we can't be DHS without our provider community. We many years ago, as state government, had decided to deliberately partner with community-based organizations to deliver on our mission together. And I know that over the past many years, we have not been an honest broker of our contract for partnership, and we're trying to do better. So I appreciate the dedication and hard work of all of you here. I heard the reduction of stigma as being a key piece of it. I think that that cannot be said enough as it relates to substance use disorder, mental health as well. But I also think that we need to talk about kind of, racial discrimination and racial inequities when we're also talking about stigma. And that's something that we all have to recognize together. So we believe in recovery here in Illinois, and we're committed to supporting all who seek it and ensuring that help is here. So thank you so much for having me. It really is a pleasure. Yes. Representative Ford would like me to take questions, and I'm happy to do that.
Any questions?
Only easy ones, please. Yes.
Yes, I have a question, and it relates to, I'm George Salter from Above and Beyond, and we were blessed to be part of the initiative that is receiving the 2020 census grant. How do you see the 2020 census project touching those who are marginalized, disenfranchised, those who are in hiding because of various stigmas, and at the same time so needy as it relates to what we're offering here?
So this is probably going to sound very unsatisfying answer, which is we think that you all know better than we do, which is why we had made the decision to identify like community-based regional intermediaries to then work in partnership with community organizations like the ones in this room so that you can work with your own community members to make that decision. I think, I came up through my career working in the immigrant and refugee community and services community. And I think, as you know, over the past many years and even decades before, there is a fear of persecution by immigrants and refugees. And so the community-based system that was created for immigrants and refugees recognized that they were not going to go into a government-sponsored building or talk to state staff about the issues that they were trying to get resolved. And so we created mutual aid organizations. So people who looked like them, people who talked with them in their own language, people who had the same experiences, they actually walked into our doors. So I think that we have created some flexibility for community members to determine themselves how best hard-to-reach populations can be reached, which is why we didn't even for a second say, well, we're just going to have state staff do this census outreach. No, we made the decision from day one to say community organizations in different neighborhoods are best situated to make those decisions. But we do want to hear back from community partners so that there can be sharing of information and best practices so that all the regional intermediaries across the different parts of the state can actually learn from each other.
And
Yeah.
Secretary, we have one of our, the MAT deals with mental health. If I be right, Dr. Safir had a question.
Yes, thank you, Representative Ford, and thank you, Madam Secretary, for being here this afternoon.
Of course.
I, was pleased to hear your comment acknowledging the importance of housing as it relates to recovery, not only in the substance use arena, but also with regard to mental health. Does the department have any plans for increasing funding for housing, especially in these West Side communities where, homelessness is at an all-time high at this point, and it continues to increase, partly as a function of the gentrification that's happening on the near West Side, where people are literally being pushed out of their homes, but also related to persons who are returning to our communities from incarceration. And we know that these persons who are returning from incarceration are at great risk of either re-engagement with the criminal justice system and for other, issues related to comorbidity. partly because of the lack of housing. Would you speak to that?
Yeah, so I think the issues that you raise are absolutely critical. So I'm going to take a stab at the variety of aspects that you talked about. And so I think many of you may know there is going to be a new director for the Illinois Housing Development Authority. Her name, I think it's public. Well, it's public, at least in the, okay. So if Rep. Ford knows, okay. Her name is Kristen Faust. She actually ran neighborhood housing services in Chicago, so she knows in a very deep way what the issues are, and I think it's really exciting to have someone who actually was trying to produce these from a private sector nonprofit level, now actually running the Illinois Housing Development Authority. And I mean, I think this speaks to, I mean, I have to say, I think the governor has good taste, but I'm a little biased. But I think that is a critical step. So we at the Department of Human Services can't really develop housing. We have to do it in partnership with IDA, and we try to be creative through the Oxford houses. We're actually working with DCEO to launch the small capital program, which I think is a modest amount of money, but we hope to work very much in partnership with that agency so that our human service organizations can benefit from it. We did see increases in our mental health supported housing funding for this fiscal year. We're in the process of increasing contracts for those who were actually decreased over the past several years, and then we're also contemplating putting out a NOFO very quickly to increase the supportive housing units. But I think, to your point, supportive housing is actually not valuable unless you actually have an affordable home, right? And so that really needs to be done in partnership. I think the other piece of it is we've also seen increases in our homeless prevention funding line as well, which many of you know enables people who are at risk of homelessness. So if they're missing a month's rent or a mortgage, we would rather help see them stay rather than fall into homelessness and then have to find them another a place to live. And so that line was also increased. We have been, I think, as you know, struggling with our compliance with 2 consent decrees, Williams and Colbert, which I know you know very well. And a key component of that is also finding affordable housing for people who suffer from mental illness or physical disabilities when they're moving out of institutions into community living. So I think that was my long kind of detailed answer, but my high level answer is that DHS needs to be working very strongly in partnership with the Illinois Housing Development Authority. And I believe, you know, having known Kristen before, that her heart is where our hearts lie in making sure that people who most need homes, safe places to live, will have them. But I think there is a lot of work to be done. And I think we need to develop a better strategy for how we work with people who are reentering communities. We know that the reentry communities is here, right? And so you may know that the Metropolitan Planning Council did a report recently that talked about specifically the cross-section of people who were formerly incarcerated and their inability to find stable housing. And so myself, as well as the director for the Department of Corrections, as well as I think Quinn Rollins from the Lieutenant Governor's Office and Paula Wolf and Metropolitan Planning Council are going to be working on figuring out how this report, which I think is on MPC's website, can not only understand the issue, but what are we actually going to do about it. So I'd love to get your feedback on that report and get a sense from anyone here whether there are key pieces that are missing. Yeah.
Right here, and here.
Hi, Secretary Hall. I'm Pam Brecky, Program Director at Threshold
Pam?
Youth Program.
Did you? Ann.
Sorry.
Thank you. Sorry.
Congested.
No, it's all right.
So I have a question. We have a program on the west side, we have a program on the south side, and we really struggle to find Suboxone providers. Mm-hmm. And one thing that we recognize is that the reimbursement rate for Suboxone is very low. It's about $67 an hour for a doctor under Medicaid versus $67 per episode. And so a lot of doctors don't want to get involved with the whole Suboxone induction and distribution because of the low reimbursement rate. I'm wondering if that is something that the state is willing to look at. Suboxone is playing a much bigger role in the opioid crisis than I think it had previously, and people are finding it's much more convenient in many cases than methadone. People can get a prescription and take it home, they can dose themselves, they can check in with their doctor. So it does provide a lot of freedom for individuals trying to deal with their substance, their opioid dependency.
So I am not 100% sure, but I know that if this rate is actually being reviewed currently with Healthcare and Family Services. So Healthcare and Family Services has engaged a consultant, Navigant, who is actually reviewing a variety of rates under super, because HFS, obviously, they're the Medicaid agency, and so they drive the rate making. But they're working very in close partnership with super. So one of the things that I can do is check to see if this service in particular is included in that survey. And then I think Thresholds, as well as many of the organizations here, will receive that survey to really help us identify where are the rates not sufficient. But yeah, thank you.
Yeah. First of all, Madam Secretary, thanks for your time. We appreciate it.
Of course.
As a veteran, I wanted to know what the connection is between the partnership between DHS and Veterans Administration in terms of services like this, because I know the VAs here are a bit overwhelmed, undermanned, kind of like everything else, understaffed and underpaid, and in my opinion, underappreciated. But there's a lot of persons who are addicted now currently who do have veteran status, but they don't necessarily reach for the services or even have knowledge of the services that are available to them. And I wonder if there is a partnership between DHS and veterans that are connecting these people where they need to go and how they need to get resources.
Yes, so Director Chapalavia, who is the director for the Illinois Department on Veterans Affairs, we meet regularly to talk about where the intersections are, and we shared with them a variety of information around who is seeking access to our hospital system. DHS, so I would say the clients for the Department of Veterans Affairs are also DHS clients. I would say that we're just at the beginning of those discussions. I know that we're not doing enough to really kind of serve veterans who've served our country well. And I think that there's probably a long way to go in that regard.
Yeah, there's a huge void in the middle there, and people are getting stuck in that void.
And so would you say that, would our veterans, do they feel more comfortable going to the Department of Veterans Affairs, or would they feel more comfortable coming to DHS?
Good question. I would say, again, there's a void. They're kind of stuck in the middle of not feeling, there's just a feeling of not, having to jump through too many hoops after providing their life as a service to the country. And it's just, you feel like you shouldn't have to go through all that to be able to be served by a country you serve.
You're absolutely right.
I just discovered, what's your name?
Kevin Cole.
Kevin Cole. Have you ever heard of Invoice? Invoice has a number of services that they provide for veterans here on the west side. And you would be surprised of the services that they have as around housing, treatment, employment, vocational training. They have it's like really huge. And not only do they provide housing and those services here on the west side, but they provide the same services on the south side.
Yeah, and I think, again, that's the problem. There are organizations like that, but it's sometimes for a lot of veterans, particularly those who are caught up in the addiction cycle, it's too big of a leap. You know, it's they're jumping through hoops because, like, I call myself informed, but I didn't know about this organization. It's just the information is not getting to them in a way that is productive for them.
Is there they can actually make out all
Check it out.
that? Number seven.
And I think one of the things that has been, actually, as I hear you talk, one of the things that I think is usually helpful is some sort of formal kind of peer sharing process. You know, there's a lot of, there is a proliferation of community navigators where people who are like you in the same experience that you are in will actually help you navigate kind of the bureaucracy. I agree with you. There are too many doors to knock on. There are too many hoops to jump through just to get one service, and then you realize that you have to go through another set of barriers to do the other. So I think that there's a way that we're trying to figure out how we can make it easier for people and actually make people feel like we want to help them and that we're not trying to keep things away from them. Yeah.
Thank you.
Yeah. Thank you. Yeah.
Okay, good enough. So thank you, Madam Secretary, for your presentation.